Department of Health and currently not found amongst members of the Board of Health. So we do take it seriously, and we are happy to continue to facilitate investigation of the citizens' complaints by this connection with the Mass DPH environmental toxicology program.
Dr. Culver, can I ask a clarifying question?
Sure.
And then I just want to note too that Councilor Connell's hand is up. But if Councilor Connell, do you want to go first? I just have a clarifying question on what Dr. Kohlberg said, but I'm happy for you to go first.
No, Steve, that's fine. Go ahead. You can go ahead first.
I just wanted to ask Dr. Kohlberg, you said that the toxicology, the environmental toxicology department of the Department of Public Health is going to or already has reached out to the residents to check to see about individual symptoms?
No, they have not reached out. The Department of Health, through Director Armstrong, has reached out to them, looking for
toxicology to
the environmental toxicology program. Both the one person who is an environmental analyst, as well as the person who is the chief toxicologist for the environmental toxicology program.
And they're going to.
And they said that they would be happy to receive the concerns of the citizens who live in that area who have concerns about their health. So we reached out to them.
Okay.
And they in turn offered their services.
They're going to avail themselves to the residents up by the cell tower. Is that accurate? Yes.
That's accurate.
Okay. Thank you.
Chris, would you like to continue?
Yes. Thank you, Mr. Chairman. I understand what you were saying, and that now we may be finally getting some type of response. And I know you had noted that the issue with COVID-19 has been the main focal point, which I understand, and I applaud the Department of Health and the Board of Health for dealing with it as it has in Berkshire County, especially in Pittsfield, which I represent. However, this issue was brought to light 8 months ago. We should have been having this conversation 7 months ago, as opposed to having a counselor's petition to get some type of response. COVID-19 aside, I understand that. And the reason why I'm saying this is because at the last council meeting, and I talked about this specifically, there was 2 issues on the agenda for a response back from the Department of Health. One was regarding this petition, which was filed 2 months ago. The response we got, as I mentioned earlier, was that we don't have the expertise. A month ago, before that meeting, there was a request from another counselor asking for a report on the violations for snow removal from sidewalks. That one was reported at the same time at the last meeting. The response time for a counselor's petition requesting information about sidewalk plowing violations was given in full at the last meeting. And the last one that Councilor Cavey and I got at the last meeting was that we don't have the expertise. I don't understand the time lag, Mr. Chairman. I'm sorry. Okay? If people are experiencing health issues regarding to a situation, and we have to wait 2 months to hear that we don't have the expertise, and yet we can submit a full report from the Department of Health regarding the number of lack of sidewalks that have not been plowed during the winter? I don't think that that's right. I'm sorry. All right. Let's be fair. Let's be fair to the residents of Pittsfield. All right. Issues like this should be priority. And they should have been taken priority 8 months ago. Thank you.
Thank you.
Dr. Colbert, Director Armstrong has her hand up.
Gina? Gina, did you?
Yeah, I do want to respond to that because there's a very big difference between a petition related to something as routine and annual as sidewalk clearing and having our nuisance control officer run data to prepare a report for a city council meeting. And so there's really no comparison between a petition regarding an environmental concern where the department has not had prior experience in addressing. And work was being done in the months prior to this in reviewing the vast amount of material that has been sent from numerous people expressing concern about EMFs and also considering different options of where we should go with this. When can we put together the resources to address this and bring it before the board? Since January, I'm sure it's really difficult for people to understand the level of resources that had to be committed to getting vaccination clinics going and public messaging and logistics. And, so to get that off the ground, I do realize there was a delay, but work has been done in the meantime, including what Dr. Kohlberg is referencing in our communications with the State Department. We've now developed an action plan. We're here tonight to move this forward, to give clear instructions on what residents can do. I think if I had received communications from specific individuals prior to this, those referrals probably would have been made sooner. To this point, we haven't received specific communications from other residents in that area. But what we'd like to do tonight is really encourage people with those specific health conditions that they believe are associated with EMF exposure to please use those resources at Mass DPH. The senior environmental analyst that Dr. Kohlberg mentioned will connect people after the initial individualized assessment, will connect them with environmental medicine physicians. So that's the level of expertise that is needed. And then referrals can be made. And once those individuals contact the state and work with them, they will report back to the Board of Health. So we'll have a report on how many people have in fact been impacted and what the possible association is. So I think, Dr. Kohlberg, are you planning to provide that contact information now?
Yes, I am.
Okay.
That contact information is for people to call 617-724-5757. And when they call, they will be calling directly to the environmental analyst at the toxicology program, and they should identify themselves as being from Pittsfield. And as Gina has already alluded to, they will be discussing these issues with environmental physicians, both at the if there are complaints that relate to children, there is a program at Children's Hospital where who they consult with. And as far as the older folks, Gina, you'll have to remind me.
Well, same thing. You know, they have a broad scope of specialists. They may refer some people to the Boston Children's Hospital, others to the Environmental Health Medical Center. I just want to clarify that number is actually 617-624. I believe you said 724.
I did say 724.
Okay.
Did I mistranscribe it? Did I?
617-624-5757.
Okay.
And residents should specify they're a Pittsfield resident and they are calling in regards to the cell tower near South Street.
It's also my understanding that there's proposed legislation that would create a committee to study this issue statewide. I looked for the information on that. I don't have that readily available. I wonder if anyone does.
I do have that information, Brad. And that is currently a bill that's in the Senate docket 2418, which was presented by Mr. Julian Sear of Cape and the Islands. And he submitted, I don't know when, it was filed on 2/19/21, just a month and a half ago. And the bill, which is still which is still in the form of a bill, it requests that there be a special commission developed to research the impact of electromagnetic and radio frequency radiation on consumer protection, public health, and technology in the Commonwealth. And it goes on to list the people who would be on the committee, including the Commissioner of the Department of Public Health, and a whole variety of people with other forms of expertise, specifically in the area of environmental medicine and radiation toxicity. I can submit this. I don't know if it's appropriate for me to submit this as part of the minutes. I can. If Gina, is that appropriate for me to submit this as an exhibit?
The Senate bill?
Yeah.
Yes. Yes.
Okay. So I will.
That's automatic because it was included in your packet.
Okay.
So it's an opportunity to work with the local delegation, the Berkshire delegation, as well as to voice your opinion statewide that this is something that's important both on the local level, but also, more importantly, it's a systemic issue, a statewide issue, and that would be a really sound approach, I believe, for addressing this issue by pulling in some real significant resources and expertise, which is probably needed to address this.
Right. Councilor Connell, if you have any other further statements or questions.
I do, Mr. Chairman. Thank you.
Because I'd like, if you could wrap up your part of it, and then
I certainly will.
We will, the board will discuss this amongst itself.
Thank you. So, based on a few comments that have just been made, Director Armstrong has said that she was unaware of any type of complaints or concerns, and I would like to direct this to her, Director Armstrong. Gina, are you saying that you did not receive, your department did not receive a call from a resident for investigation in the summer? And are you also denying that you received an email, a follow-up email from me in August requesting what is happening to that investigation?
I'll clarify that I received an email and had a phone conversation with Courtney Gilardi, and she gave specifics to one individual and with specific conditions, but I did not hear from residents from other households in that neighborhood.
Okay.
That's what the point I'm trying to make is that other residents that reside in that neighborhood did not make similar reports to the health department as Courtney Gilardi did.
And what about my email to you asking for follow-up that was not returned, was not replied to?
Well, again, I will state that we were researching the resources needed to address this concern. That we did not have the ability to do that. And also there's a learning curve. This is something, EMX is not an environmental hazard that we have experience with. So calls were made, and, you know, just working on a plan took some time to figure out what resources are really needed to do this to the level that is necessary.
So if that's the case, in August of last year, which was 8 months ago, you were at the point where you were saying that you need to develop a plan. Why wasn't that plan presented to this board at that time, as opposed to waiting until two counselors, myself and Counselor Cavey, have to submit a petition to force a response? Number one. Number two is you mentioned the issue about addressing the issue. We were asking a response from the issue, which we never got. And now we're 8 months later, and we're 8 months down the road, irregardless of what may be happening, regardless of the residents' health concerns or regarding. I mean, it's just like it gives the impression that nobody is cared and we're kicking the can down the road, right? And to not even respond to a city councilor, right, requesting, right, what you're planning to do, or are you going to be doing this inspection, all right, it's disrespectful, in my opinion. I try to be respectful to everyone that I deal with. But I was concerned, and I'm concerned right now about the residents that I represent, right, their safety. And I can't even get a response as a city councilor from a department head? That's not acceptable. I'm sorry. Okay? So you can say everything you want about you were dealing with this back 8 months ago. Bottom line is, we're here to get today, 8 months later, and now we're developing a response. I'm sorry. It's not acceptable to me as a counselor, and if it's acceptable to my other counselor members, that's up to them, but certainly not to me. So, Mr. Chairman, I will close on that note. I want to thank you for your time in the boards, hearing this issue, and hopefully going forward, we can finally get some type of response in action. Thank you.
Thank you, Counselor. And I will pick up on that last sentiment by saying that it is the intent of the board and the Department of Health to try to develop an action plan and to move forward from this point with something that might suggest what the remediation might be, or at least what the, if not an immediately a remediation, at least to clarify the issue and to develop some sort of better scientific understanding about what's going on. So thank you, Counselor. The board's going to discuss it now amongst itself. So, picking up with, I think the views have been aired. Any by the counselor has articulated them. Anybody else on the board would like to add anything else at this point regarding this issue? If not, I am going to make a couple of motions.
Kimberly has a,
Dr. Colbert?
Yes. I'm sorry, Steve, I didn't see you there. Go ahead.
No, I was just pointing out that Kimberly was raising her hand.
Oh, Kim. Sorry, I didn't see
Put
that.
my little hand down. That's okay. I
Go
did
ahead,
it
Kim. Thank you.
analog first.
Yeah.
I'm hoping that that we all availed ourselves of the public comment through the Department of Public Health when we have this public forum. I can understand that possibly some residents didn't want to contact the city health department for privacy reasons, and that, going forward, they'll, may feel more comfortable contacting the State Department of Public Health directly, so that we can get some numbers of knowing how many people are feeling like they're being affected from the EMFs. That's all.
Okay, thank you. And Gina, I'm gonna say this. You had corrected me on the phone number, and you may be right about that. I had said 617-724. You said it was 617-624. I had written down 724 twice. So if you don't get an answer at 624, or if somebody picks up at the at a meatpacking plant or something, then try 724, or you might get somebody in environmental toxicology.
all right, I'll see if I can look online while we're talking.
Okay.
But I also wanted to just say a few more things about the public information forum, because we'd like to get this set up as soon as possible, and hopefully for our next Board of Health meeting. But that all depends on the availability of the panelists that will be offering the session. And also, we would like to hear specific questions and concerns from Pittsfield residents that they will receive in advance of the forum, so they can speak directly to those concerns and provide those answers during this session. And those questions and concerns can be sent by email to the same address as the other information that will be sent in from folks that were hoping to participate during the public comment session. And that should go to B Rozon, so BROZON at cityofpittsfield.org. So we welcome that input from the community prior to the session. And then we'll publicize the date. We're hoping for May 5th, and we'll try to get that scheduled as close to May 5th as possible.
Okay, thank you. Any other comments from members of the board?
Up to May 5th, and even after, I just want to make it clear that our residents have the option to call the number that you gave out. Am I correct?
Correct.
That is what's preferred, right? Is that they call the environmental analyst directly.
Right. Okay.
In Boston, right. So if I may, at this point, I would like to make a motion. I'd like to make we'll take it one at a time. That the Board of Health support the State Bill Docket 2418, the one that I mentioned before, and that will be submitted with the minutes relative to the disclosure of radio frequency notifications. I'd like to make a motion that the Board of Health support that state bill, and that we communicate with our legislative delegation the importance of moving it forward, so a more comprehensive approach can be taken on this issue. So that motion.
I'll second that, and maybe a friendly amendment that support include a formal support letter from the Board of Health to the members of our delegation.
Thank you, Brad.
And if I could add to that, I think it would be beneficial to also include in that correspondence Mass DPH as well as the governor's office.
You would like that letter to go to Mass DPH as well as the governor's office? Got it. Okay, so that motion's been made, it's been seconded. Can I see a vote of all those in favor? Okay, it looks like it's unanimous, 5-0. The next issue, which has been alluded to already, is the panel presentation, the public forum, which will be attended to by members of the environmental toxicology program, and presented hopefully with if we can find a time that's good for everybody by the first week of May 2021. I'd like to make a motion that we have this panel presentation for the purpose of public education on the issue of electromagnetic radiation. I may be saying it incorrectly. There's a lot of electromagnetic and radio frequency radiation. Gina, did you want to say something?
No.
You look like you were about to say something. Okay, so that motion's been made regarding the panel, the virtual panel forum. Anybody? Do we have any seconds on that? Steve Smith, second.
Second, yep.
Okay, all those in favor, please raise your hand. And again, we have a unanimous vote on that, 5-0. So those two motions having passed, that we support the state bill, we'll communicate with our delegation as well as the governor via letter, the importance of moving that forward, and then we have also approved the panel presentation for the purpose of public education. Okay. We will move on our agenda.